So for the next section of special tests, I'm going to do medial and lateral instability with the valgus and varus stress tests. For the valgus stress test, I'm going to apply valgus at 0 degrees. So I'm going to support the distal part of his leg, and then I'm going to grab his knee, and at 0 degrees, I'm just going to push it in and see if there's any laxity. And then I'm going to do it at 30 degrees and see if there's any laxity. And if there is, that would be positive for an MCL tear or strain, and then injury. And then I'm going to do varus. So I'm just going to do it on the opposite leg. This is testing for LCL injury or tear. So I'm going to, again, support his distal leg and then do it at 0 degrees and then push on the medial side and test that LCL at 0 degrees, and then do it at 30 and then test it again. And if there's any laxity in both, it would be positive for LCL on varus, and then laxity on valgus, that would be positive for MCL. And then for my next section for special tests, we're going to do posterior instability. So I'm already set up in posterior drawer test. I flexed his knee up to 30 degrees and I'm sitting on his foot. And then I'm going to apply a posterior force on the tibia and push down. And there's no laxity at all. I would test it on the other side too to compare, but this would be a negative. I can combine this with the anterior drawer test and pull forward, kind of go back and forth, and it'd be negative for ACL since there is not a lot of laxity on this one either. For posterior Lockmans, I'm going to have you straighten your leg out, and then I'm going to put, actually this is kind of hard, distal thigh, and then, oh wait, this is your PCL, okay. And then I'm gonna apply a posterior force to the tibia and see if there's any laxity with that, and there's not, so it's negative for PCL again. Godfrey's 90-90. I'm gonna have you put both of your legs into flexion on 90 degrees on both legs, and then I'd look to see if there would be an indent on their tibia caving in. That would be an indicator of a torn PCL. And then posterior sag, so you can put that leg down. And I'm gonna have you flex your knee, and then I'm gonna have you drive your heel into the bed as hard as you can. And I don't see any, it's negative since he doesn't have a torn PCL. But if the tibia were to go flat while he contracted his quads, then that would be another indicator of a torn PCL. Quite positive. Okay, for anterior instability special tests, I already did anterior drawer. I combined it with posterior. I'm gonna do Lely's and anterior Lockman's. Lely's test, I'm gonna have my patient flex their knee. I'm gonna put my fist under their calf, just above under the belly of their calf, and then I'm gonna grab their knee or their thigh, and then apply a posterior force to the distal quads, and then it's not the edge of the bed, but if he were, his foot would be flexing up if it was dangling here. Like this. Okay. His foot flexing up is an indicator that he does not have an ACL rupture, but if his heel was not lifting, then his ACL would be ruptured. For anterior Lockmans, again, I'm going to have my patient's leg stretched out, and then I'm going to put my hand on the distal thigh just above the patella, and then I'm going to apply an anterior force and test for the ACL. And if the tibia were to come forward in the front, it would obviously be positive, but his is negative. His tibia stays put because his ACL is still there. and then that would be Walkman's for anterior positive. For Thessaly's test, we're gonna do a little dance. We're gonna say his left leg meniscus is injured because we're on meniscus special tests now. I'm gonna have you bend your knee, and then I'm gonna be going your left foot, and then I'm gonna grab your hand. I would grab his other hand, but I'm holding the camera, and then we'll go side to side in rotation. If you had any pain with that, and if there was any catching or clicking, that'd be an indicator of a torn meniscus. We're on to Steinman's tenderness test, still on meniscus. We just did meniscus, the first one. So for Steinman's tenderness test, I'm gonna grab his heel, and I'm gonna go into flexion and extension, and I'm gonna internally rotate and externally rotate his leg to see if there's any sort of pain, clicking, or catching. So internally extend. This is a little hard. It's a big leg. And then if there's any pain, clicking, or catching with that, that would be signs of a torn meniscus. For McMurray's, this is the ice cream scoop test. I'm gonna go ahead, my patient's gonna be in full flexion. I'm gonna grab the heel again, and then I'm gonna palpate for the medial joint line. I'm just gonna feel through medial joint line. And then I'm gonna externally rotate the tibia and then apply a valgus force while bringing the knee back into full flexion. So I'm gonna feel this joint, and then I'm gonna pull up the medial joint line, externally rotate tibia, and then pull in as far as it'll go, and then slowly pull it out. And then I do the same thing, internally rotate while it's flexed, lateral joint line, push out, varus, and then pull into flexion or extension. And if there's any clicking, catching, or pain, that'd be also a positive for McMurray's test and positive for a meniscus tear. And then aptly compression test, my patient, I'm gonna have you lay on your stomach, so we're gonna pause and we'll be right back. For the aptly compression test, I will have my patient lay on their stomach, and I'm going to apply a force through their heel down through their tibia. I'm gonna have their foot, leg or their knee flexed, obviously, and then apply a force down, and then internally and externally rotate the tibia. It's kind of hard to do with one hand right now. Push down, and then internal and external rotation while pushing down. And if there's any catching or clicking with that, positive for a meniscal tear. For pinch tests, I'm gonna place my thumb on the joint line of where the suspected meniscal tear is. So if it's a suspected medial meniscal tear, I'll put my thumb on the medial meniscus joint line, and I'll apply pressure, and I'll passively extend and flex my patient, and if they have any pain with that, it would be positive for medial meniscus. And if I did it on the lateral side, lateral joint line of the meniscus, which I can't find, there it is. Flex and extend. If there's any pain with that, that'd be positive for a lateral meniscal tear. For duck walk, we'll just do it really fast. Come here. Stay right there. I'm gonna have you butt to your heels, and then I'm gonna have you walk to me. And if you had any pain with that, be positive for meniscal tear. For patella and patellar tendon special tests, the first one is patella tendon length test. I will measure the length between, I'd have a measuring device, but I'd measure the length between the superior pole and the inferior pole of the patella, and then I would also measure the distance between the inferior pole of the patella and the tibial tuberosity. So kind of like a ratio right there. And then if the ratio was less than 1, it would be patella alta, and then if the ratio was greater than 1, then it would be patella baja. For patellar apprehension, I'm gonna say his right leg is the one with the meniscal, or with the patellar was the hurt leg, since I'm on the left side. And I'm gonna put my thumbs on. Go ahead and put your leg down on the medial border of the patella, which is right here, and then I would gently push the patella laterally. I would use both thumbs, and I would push it laterally as far as it would go, and then let it come back. And if the patient is apprehensive about the movement or contracts the quads to protect against the subluxation, that'd be positive for a dislocated patella. And the patellar grind, I'm going to have you in full position, in full extension, and then I'm going to put the web space of my thumb on the superior border of the patella, and then apply a downward and inferior force on the patella. So I'm going to push down towards their toes with the patella. Where's your patella? There it is. I'm going to pull down, and then I want you to flex your quads. Flex. Are you flexing?
Yeah.
Okay. This is called the patellar grind, and I'm going to do it one more time. There you go. There was a little bit of that grind. Pain with the movement of the patella or inability to complete this test would be a positive for chondromalacia. And we're going to move on to the last tests. And then last two tests for IT band syndrome. The Noble's test, I'll do Renee's in a second. The Noble's test, I'm going to have my patient lying supine on their back, and I'm going to put my thumb on the lateral epicondyle. Let me find it. And then I'm going to have my patient and then I will passively flex and extend their knee while maintaining pressure on it. So just relax, I can do it. And then I will extend, or flex, and then extend. And I'm putting pressure on their IT band, technically. And if there is any pain on that lateral aspect at 30 degrees or any time in that movement, that would be an indicator of IT band syndrome. And then for Renee's test, I'm going to have my patient stand up. And then I'm going to have you put your thumb on your lateral, right where my thumb was just now. And then I'm going to have you squat. And then, like a mini squat, but it's okay. Mini squat, and then come back up. And then if there's pain with that, that would also be an indicator of IT band syndrome.